My name is Michelle Waugh. I'm a registered radiology tech. I'm a registered diagnostic cardiac sonographer. I'm a registered vascular tech, and I'm a registered diagnostic medical sonographer. I have been in the cardiology field, specific to cardiology, 30 years. And prior to that, diagnostic ultrasound for 4 years. Prior to that, radiology for a total of 43 years full-time. Yes, January 21st, 1982, I got hired. I love the heart. Love the heart. Everybody's heart is different. Every day is something new and still learning, still loving it. Dr. Clyde Metzger, who was my mentor, who passed away a few years ago. Having a mentor is everything in any job. You guys know this. So if you have a great mentor, it makes you love what you do and have a passion for it, right? I did not. I knew Dr. Metzger. I knew him because I went to surgery and did fluoroscopy for him inserting pacemakers, and we all feared him greatly because he was a person to be feared, but he was a person that demanded excellence. And if you ask him a question, he expected you, if you didn't know it, to know it the next time you ran into him. And I just really responded well to him. And I responded well to, he became like, not just my mentor, but like a father figure. But he was that way he was the first doctor that taught CPR in these hospitals. They did not do CPR before Dr. Metzger came here. If you had a massive MI, everybody just went, we don't know what to do. He came from Pittsburgh and taught the nurses how to do CPR. That's how much this man is fabulous. And he deserves props. So I work in Dr. Raphael Schmolwich's office, which happens to be an office of excellence for 2 years within the health system. I do typically 9 procedures a day. I do both echoes and carotids. I'm registered in both cardiology and vascular imaging. So I do, some patients are double studies, echoes and carotids, and some patients are just single studies. But typically I come in at 5:30 in the morning. 6:30 is my first patient. I do a 6:30, 7:30, 8:30, 9:30, 10:30, 11:15 patient, and then I come back after lunch and do a 1, 2, and a 3 o'clock. So I work 4 10-hour days in Dr. Schmolwich's office, and we are a high-volume office, as you guys probably know. We do a good job up there. A lot of collaboration in Dr. Schmolwich's office. Lisa Cush is the nurse practitioner. She's super highly involved in every aspect of everything. Dr. Schmolwich, of course, great to work for. Fantastic cardiologist. Probably the best person to person. If you've ever interacted with Dr. Schmolwich, she's just really personable. The people, for sure. Both my coworkers, my supervisors, my managers, and the patients. Of course, you learn something new every day. And it's not always about your job, right? Sometimes it's the more snow you get, the greener the grass will be in the spring from the farmers. I'm like, what? But if you listen to people, you learn a lot. It's a great job. I think we have a really complete service line now, from primary care physicians to advanced, whether it be interventional or structural cardiology. And they brought on new young doctors. Dr. Yassine is in our office. Fantastic, wonderful to work with. Young, smart. I think that the community could want. It is offered here as far as our cardiology line of service.